Hello everyone and welcome to my channel Annotated Medical Tutorials. Today we want to start a new topic called the anatomy of the thorax. So for us to start the anatomy of the thorax, we first of all need to look at the thoracic cage. Specifically in this area, we're going to be looking at the anterior part of it, which is made by the sternum. So we all know that the thoracic cage is made of the ribs laterally and the sternum anteriorly, and at the back we've got the thoracic vertebra. So here I'm drawing the sternum. It has got three parts, which include the first part called the manubrium, the second part is called the body of the sternum, and the lower part is called the xiphoid process of the sternum. So let's start off by naming the parts of the manubrium sterni. Here we've got this notch called the suprasternal notch. This is simply because it is found above the sternum, so we call it suprasternal. Here we've got the facet for the clavicle, where the sternum or the manubrium part of the sternum articulates with the clavicle. There we've got the facet for the first costal cartilage, which is the cartilage that attaches the first rib to the manubrium. So this one would be the second, the third, the fourth, the fifth, the sixth, and the seventh. Again, here is the suprasternal notch. Here is where the clavicle articulates with the manubrium, and the first costal cartilage articulates here. And there we've got the second, the fourth, the fifth, sixth, and the seventh. So at this point, I would like to make sure that you observe that after the seventh, no other costal cartilage articulates with the sternum directly, but they will have to go through the seventh costal cartilage. So that will be the seventh, eighth, ninth, and 10th, and this 11th and the 12th ribs are free floating. So at this point, I would like to mention something of clinical significance. Here we've got the manubriosternal joint, which is opposite the intervertebral disc of the fourth and the fifth thoracic vertebra posteriorly. We have got a transverse ridge that we can feel at the chest superficially. So this one would be a surface landmark. This point is called the angle of Louis. So it's the transverse ridge that you can feel at your chest physically. It's called the angle of Louis, and it is of clinical significance when we want to find the apex beat of the heart. We start off counting the intercostal spaces from the angle of Louis. We know that the angle of Louis would be the position where we find the second costal cartilage, hence the second rib. So from there, if we locate it, just below it we find the second intercostal space. Then so we say second, third, fourth, fifth, going in the left direction, and when we reach the fifth intercostal space, we should find the mid-clavicular line. That's where the position we find the apex beat of the heart. It's in the fifth intercostal space, mid-clavicular line. And this is of clinical significance in that during the ward rounds, the consultants can even ask you to find the position of the apex beat, whether it is correctly located or it has been shifted by conditions like cardiomegaly or even tension pneumothorax. And this can be a clue to the diagnosis of the condition that the patient has. So now back to our drawing, we said that the sternum is made up of three parts. The first part is called the manubrium, and this part is called the body of the sternum. And then lastly, we have got the xiphoid process. This one is just a plate of cartilage which calcifies in adult life. So the proximal part of it calcifies in adult life. The manubrium articulates with the body of the sternum at the manubriosternal joint, which is of clinical significance because that's where we find the sternal angle, also known as the angle of Louis. This manubriosternal joint, or the angle of Louis, is located in between the body of the fourth and the fifth thoracic vertebra. So to be specific, it is at the level of the intervertebral disc of the fourth and the fifth thoracic vertebra. On the other hand, the manubrium lies at the level of the third and fourth vertebra. So when the body of the sternum meets the xiphoid process, the joint is called the xiphisternal joint, and this lies opposite the body of the ninth thoracic vertebra posteriorly. So now it is the time where we mention the clinical correlates of the sternum. We should know that the sternum possesses radiohematopoietic marrow throughout life. So it is the common site where the marrow biopsy can be done. So under local anesthetic, a wide bone needle is introduced into the marrow cavity through the anterior surface of the bone so that tissue can be obtained and then sent to the laboratory. Also, the sternum can be split open to gain access into the thoracic cavity to structures like the heart, the great vessels, and the thymus. This is done during a surgical procedure by the cardiothoracic surgeons in a cardiothoracic surgery, like open heart surgery. So if you find this video helpful, the only way you can support us is by clicking the subscribe button and the notifications bell so that you can be notified when we upload the next video. Goodbye.